So in the ARCHES trial, this was the phase 3 study of enzalutamide versus ADT alone in men with metastatic hormone-sensitive prostate cancer that has now led to FDA approval in this setting by extending radiographic progression-free survival as well as overall survival in these patients. The several posters that we have at ASCO 2022, the first one was examining the patterns of radiographic progression when patients are on ADT enza versus ADT placebo, as it compares to how their PSA changes. So we have what's called prostate cancer working group criteria for PSA progression. And we actually identified that many patients on a potent AR inhibitor lack PSA progression when they have imaging progression, meaning their scans are showing worsening disease over time, but their PSAs are not rising. And about a third of patients had no rise at all in their PSA when they had imaging progression. This data suggests that men should be routinely imaged with soft tissue and bone imaging to make sure we're not missing important radiographic events. These radiographic events, as we show in the poster, are associated with a worse survival. Fortunately, in the ARCHES regimen, enzalutamide delayed radiographic progression significantly, so there's many fewer of these events over many years of follow-up than with a placebo versus ADT. But it's still important to be vigilant for this disconnect between imaging and PSA progression. Separately, we looked at a very important isoform of a gene important in androgen metabolism. It's called the 3-beta HSD1 gene. Dr. Nima Sharifi is presenting this poster on this important single nucleotide polymorphism that predicts for poor outcomes when you have ADT alone. This is a germline mutation. This germline mutation in ARCHES, however, was not predictive of any differential benefit from enzalutamide. We showed that enzalutamide improved overall and progression-free survival regardless of whether you had this genotype, suggesting that we shouldn't be using this genotype to select for patients for enzalutamide plus ADT. Interestingly, we showed that patients who have this adrenal permissive genotype have differences in toxicity, more estrogenic type toxicities, probably because of higher androgen and estrogen levels, such as gynecomastia, but a lower risk of fracture. Separately, we've looked at outcomes by age as well as by DNA repair deficiencies. And these two posters categorized a very similar and safe benefit of enzalutamide irrespective of age, whether you're under 75 or over 75, but with more adverse events in the elderly patient population, calling attention to the need to be vigilant for adverse event monitoring, exercise, blood pressure monitoring, and cardiovascular risk reduction. In men with DNA damage repair mutations, we know that these patients do more poorly, but they can do just as well with the addition of a potent AR inhibitor. And so it's important to understand that as we develop PARP inhibitors, even in the hormone-sensitive disease state.